Hello everyone, I'm Ken Kara, and right as I'm recording this, it's a cold day in northeastern Pennsylvania during the winter months here, and it seems like everyone is sick. At least that's what everyone is saying out there. I'm very happy to be joined today by Dr. Christopher Lenevy. He's a pulmonary and critical care doctor with the Lehigh Valley Health Network, and he works at the Lehigh Valley Health Network Topper Cancer Institute. I've seen people sniffling and coughing all over and saying, oh, it's my allergies, I just have a cold. When is it do you say, hey, okay, you maybe need to go see a doctor and let's get this looked at?
Right. So cold symptoms and pneumonia symptoms can actually oftentimes overlap, so it can be very difficult to say, well, when has it really transitioned to more of what we call an upper respiratory infection to a lower respiratory infection. Now, things like persistent fevers, we're talking for longer than a week, that would be a red flag that I definitely would say you would need to talk to your doctor about. Persistent symptoms that last over that 10-day, 2-week period that really aren't getting better, I would also say that would be something to talk to your doctor about. In addition, any severe shortness of breath, if somebody has a pulse oximeter, that's the device that goes on the finger that tests oxygen levels in the blood. If that is running low, or any type of severe symptoms, that may be something that prompts either an emergency room, urgent care visit, or even a 911 phone call if they're severe.
You mentioned maybe similar symptoms with COVID, flu, and RSV. What are some of the differences?
Right. So, we did see a lot of patients coming in with things like loss of taste, loss of smell with COVID, and that did tend to get a little bit of notoriety, in particular because so many patients had COVID. It's very easy to talk about common symptoms when 10 times the number of patients have a specific virus. But I have had patients with many other types of virus, influenza included, that have had loss of smell and taste. So I wouldn't say it's necessarily an exclusive symptom to any one of those viruses. And there may be some tendencies of certain symptoms to go towards one virus or the other. But like I said, there's a huge amount of overlap, and it's very, very difficult to say, in particular, if one symptom can lead to one virus, or is, I should say, associated with one virus or not. Really, the only way to definitively differentiate between them is nasal swab testing.
And you said really it sounds like they could cause the patient similar symptoms. They're going to have trouble breathing and everything. And there's difference in the way you treat them. You said for COVID and flu, there's some treatments. RSV, not so many. It's just taking care of it, or
correct. So many of the treatments that we have available that have been studied in medical literature are really involving patients with severe illness. For example, patients in the ICU with COVID infection, influenza with COVID pneumonia, influenza pneumonia. So, for example, with COVID, there's a number of trials looking at giving a high dose of a steroid, similar to prednisone that many people are familiar with, and it reduces the inflammation that is generated by that COVID infection and can actually lead to what we call decreased mortality, which means it saves lives. So that's kind of the benchmark for medical professionals. If a treatment reduces mortality, it means it saves lives, and that's something that we give to all patients. But really, that's only been studied and proven in the critically ill population. So individuals that are seeing me in the intensive care unit, for example, on ventilators and incredibly high amounts of oxygen. So we find that those patients do much better with doses of steroids.
For people who think, hey, I don't know if I should go to the hospital, I don't know if I should go to the emergency room, is waiting too long a problem sometimes with these things? Would you encourage, hey, if you have been experiencing these symptoms, like you said, for longer than the amount of time, don't fool around, go to the emergency room?
I would encourage all people to not delay. If they feel that there's a problem in their body, it would be best to be able to be evaluated and find out, you know what, things aren't so bad, then the opposite. So you're absolutely correct in that waiting too long can actually delay care, delay treatment, and unfortunately can lead to worse outcomes if patients delay, for example, if they have pneumonia. Getting on treatment as soon as possible, we know will really improve patients' outcomes. So if a patient really feels there's something wrong, severe shortness of breath, low oxygen levels, I would encourage them to go into their either family doctor, an urgent care emergency room as soon as possible.
You mentioned the flu vaccine we were talking about, also the COVID vaccines. Good tools to maybe try to prevent getting the flu or cold?
Correct.
Or flu or COVID, I'm sorry.
So it's vaccines are a training session, right? So if an individual wants to lift a certain amount of weight, they have to build themselves up to that. And vaccines essentially put the body through a training program. So if by giving someone a dose of a fake COVID virus, the body now can recognize COVID And then when the real COVID infection occurs, well, it can recognize it and better handle it and kill it. Same thing with influenza. The influenza vaccine is based on the prior year's 4 most common strains. We know that influenza likes to mutate. Unfortunately, a lot of viruses do. But playing a numbers game, or our hope is that the prior year's 4 most common strains will be covered in the next vaccine and hopefully help patients learn how to fight those viruses before they actually show up.
I just have 2 more questions on this topic, and one is, I have heard people say, I've gotten the flu vaccine and I still get the flu, or I've gotten the COVID vaccine, I still got COVID. They seem to kind of give up on it. You said that's expected to happen sometimes. Correct. That's okay. You should still do it.
Vaccines are designed to not get a virus, but they're designed to help a patient fight a virus when it shows up. So, the hope is that, for example, if a patient's unvaccinated and picks up an infection, they might have a 10 out of 10 illness. Perhaps if they were vaccinated, they might have a 5 out of 10 illness. It decreases the severity by training the immune system to fight the real virus when it shows up. So again, from a medical perspective, the hope is not to never get the virus, it's to decrease the severity so a patient's not critically ill and in the ICU as a result of the infection.
Last thing I want to ask, we are maybe feeling a little sick. To protect ourselves and each other, you have to live your life, as you said, you might have to run to the grocery store or do something. What advice do you give to people to, hey, maybe you should stay home at this point? Or what advice would you have on that front?
So one of the common misconceptions is that, once my symptoms start feeling better, then I'm not infectious, but that's usually not the case. Symptoms and the infectivity or infective capabilities of a patient don't always come hand in hand. So for example, influenza, a patient will actually be able to spread the virus 1 or 2 days prior to them developing symptoms. So I encourage all people, when they're still feeling ill, still feeling sick, to stay home, get plenty of fluids. It's very common for patients to get dehydrated when they get infections. And really once they start feeling back to themselves, that's when they can get back to work.
Dr. Lenevy, thank you so much for your time. Anything I didn't mention that you feel is important this winter season, or really any time? We're specifically talking about COVID, flu, and RSV right now.
I think one of the important things is, when patients, as they age, sometimes they get short of breath, they start not feeling like themselves. One thing I really encourage all patients to do is if they feel like something's going on with their bodies, to check in with their primary care doctors. And then hopefully we can get appropriate referrals to specialists like myself in the pulmonary department to really start teasing out the details as to why somebody's feeling the way they're feeling and get to the bottom of it. So many patients will downplay symptoms, and it's again, if it feels off, it might be, and it's best to get looked at.